Let's dive deeper into the newly updated CDC guidelines. Those new changes have raised a lot of new questions and caused quite a bit of confusion. So here to break it all down for us is Dr. Alok Patel from Stanford Children's Health. Dr. Patel, let's just get right to it. Many Americans are just flat out confused. I have to admit, I found myself reading these new guidelines more than once. So help give us some clarity here. The U.S. just set a record high for infections. So if we are seeing cases go up, why is the CDC shortening the period of isolation now for some Americans that test positive?
Well, Rachel, you're not alone by a long shot for people who are confused right now. And the CDC is doing this what we think is twofold. Number one, it is based on some of the science and the data showing that people are most contagious right before they get symptoms or maybe a couple days after. And that's where they came down with this line of saying, hey, 5 days, if you're asymptomatic after a positive test, you can lift yourself away from isolation, but wear a mask for a full 10 days. And then another component to this is just trying to make sure we have people able to go back into the workforce, to airlines, retail shops, hospitals, to keep the country going, to keep the economy going. But obviously, there's a lot of confusion here. And one of the biggest criticisms is that in this upfront guideline, there is no differentiation between people who are vaccinated, fully vaccinated with a booster shot, or unvaccinated. The only differentiation comes from people who have had an exposure. There needs to be a little bit more clarity there.
And under these new guidelines, if you test positive for COVID and have no symptoms, you only need to isolate for 5 days. But the big question, how can you make sure that you're no longer contagious then?
You have exactly nailed why there is some questions right now and not differentiating between those who are vaccinated and unvaccinated, because by and large, you can't really tell unless you go out and get negative antigen tests or a negative PCR test, which is very difficult to come by in some parts of the country. And Rachel, another issue here is that this involves some form of an honor system or self-policing. We're expecting people who are not vaccinated, who may test positive, to after 5 days of no symptoms then say, hey, I'm going to wear a mask to protect everyone else around me. And that seems like an idealistic scenario. So I do wish that there was some more clarification here, and the CDC included separate kind of categories for those who are vaxxed, unvaxxed, but also some more recommendations about getting a negative test.
Yeah, so many people have brought that up. How are you going to police this to make sure that people actually do wear a mask? So let's actually talk about that. At this point, what is the best mask? How often should you be replacing it? Give us some pointers here.
Here's the big pointer, is that those cloth masks, yes, technically they're better than nothing, but we've learned more about the virus itself, Omicron being extremely transmissible and contagious. So you want to get a high quality mask. If you have a 3-ply surgical mask, that's great, but even better are those N95s, KN95s, or an equivalent. If your mask gets damaged, if it gets loosened, if you lose the fit, if it gets soiled, you do want to replace that. So you do want to pay attention to wearing those masks. And please, if you've had any exposures or test positive, do the right thing, wear a mask to protect everyone around you.
Yeah, I just picked up a new fresh box. So the question on everyone's mind is, when is this all going to come to an end? It just seems like a never-ending nightmare. I know you don't have a crystal ball, but is it possible that this wave could be the beginning of the end?
It's possible. I'm not a crystal ball person. I'm more of a magic 8-ball where I just kind of like look at things. Rachel, I've only been right about one prediction, and that's the vaccines are going to work, and they are doing an incredible job. As far as the surge right now, some modeling does predict that we could see a spike in Omicron in the middle of January. But if society does not do their job, if the variant proves to evade vaccines, evade antibodies like our fear is, it could be prolonged to later on in spring. I think the important thing there is that we have a lot of control on ourselves as a society to make sure that the surge happens in January and then it stays in January and it starts to go down after that. People need to pay attention as we try to get our lives back and we see that this virus is becoming endemic. We're going to have to learn to live with it.
Well, crystal ball, magic 8-ball, listen, whatever it is, we are very lucky to get some advice from you, Dr. Patel. We so appreciate your time. Thank you.
Thank you, Rachel.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.